Hello everyone, this is Dr. Julka and I'm going to be talking about endoscopic carpal tunnel release and whether you should have one hand done or both. Before we go over the pluses and minuses, I want to show you the device that I use. This is an endoscopic carpal tunnel guide and blade. Within it goes a camera, so that plastic tube you see there actually fits a small camera which looks up at the ligament. This little trigger right there, once I depress that, it elevates a small blade, and that's the blade used to cut the carpal tunnel ligament. So a lot of patients ask, are you cutting the ligament? Are you removing it? We are cutting it, so we're cutting it down the middle, and you'll see that in this video here. This is a video of one of my surgeries where we've gone underneath the carpal tunnel ligament already, and as you see that blade come up, that small little blade is able to cut the ligament. It usually takes 1 or 2 passes. Now the really big benefit of doing it in this fashion is that we can cut the ligament, but we do not have to cut the muscle, we don't have to cut the fat, we don't have to cut the fascia, and all the other things that we would have to cut if we did a standard traditional sort of open carpal tunnel release where we're making a big incision on the skin. Within a matter of minutes, the surgery is complete. And in the past, at least, I was placing a single stitch as you see here. I've modified this technique recently. More and more I keep getting patients from hours away, sometimes from different states, and certainly they don't want to travel a couple hundred miles just to have a suture removed. So we've been going to sutures underneath the skin and glue, which has been a huge benefit to a lot of patients. All decisions on doing one hand versus both hands are made in the clinic with my patients, and I counsel everybody extensively on what the benefits and downsides might be. Now, if you choose to do one hand, what are the positives? Well, many patients have anxiety, frankly, about doing both of their hands. Realistically, this is a very safe surgery, but you can't help but think, what if something goes wrong? And what if something goes wrong with both my hands? So it can be anxiety provoking. For those patients, doing one at a time is perfectly fine. You do get to keep one working hand, so you have one hand that's perfect, that can lift, push, and pull without any restrictions. And you certainly have a quicker recovery because you're only recovering one hand at a time. The negatives might be, look, if you have pretty severe disease on both sides, you're going to continue to have symptoms, you're going to continue to wake up at night and not be able to sleep, which can be a big issue. You are going to take 2 trips to the operating room, not 1, and there will be a second recovery that will take about 4 weeks or so. So we're going to see videos of patients of mine. The first one is a patient who had one side done 10 days after surgery. Glue closure was performed on this patient. You can see the patient moving very well and pretty minimally swollen there. The second patient actually had a glue allergy, so we sort of improvised. We used steri-strips and tape with deep sutures underneath. And you can see both hands look pretty symmetric, minimal swelling, minimal bruising. Now, what if you choose to have both sides done? The number one positive my patients tell me after having both sides done is that they are done with surgery. No more trips to the operating room, just 1 trip, and certainly for many patients that have a high deductible, it can be much lower cost. You know, a lot of patients don't realize that the number one cost to you from having surgery is not the surgeon's fees. They're actually the hospital's fees or the surgery center's fees. So it can dramatically reduce that having both sides done at once. The biggest negative is really that you need more assistance around the house. While I do let you take off all the bandages the next day, shower, do your hair, go to the bathroom, make breakfast, and all those light activities, I don't allow you to do heavy activities or heavy lifting, pushing and pulling with your hands. It is also a slightly longer recovery. Instead of recovering from 1 surgery, you are recovering from 2. Here's a recent patient of mine, 10 days after surgery, had bilateral endoscopic carpal tunnel release. Glue closure, as I mentioned before, was performed on this. And you can see the patient can move the hand just fine. They do have a little bit of swelling, a little bit of bruising, but nothing significant. You can also see the wrist is moving fairly well. And of course, with the smaller incisions and the glue closure, the incisions are very well healed. So we return to the question, one hand or both. To get to the answer for yourself, and it is really a personal decision, the most important thing is you clarify any misperceptions you have about the surgery and you become as educated as possible. And once you're educated on this topic, there is really no wrong answer. It is just whatever you prefer and is best for you. So what do patients say? Most of my patients, when I ask them if they've had both done or one done, would you do it the other way? They generally are happy with the choice they made. They say, I would have it done this same way every time. And once in a while, when I have patients who've only had one side done, they will say, maybe I should have done both. We understand that this can be a hard decision to make, and myself and my team are happy to guide you through every step of this process.